Would you all please join me in welcoming Larry Merlo?
Well, Kim, thank you for the introduction, and thank you all for having me. It's truly an honor to be here today. You know, Town Hall Los Angeles is one of our country's great public forums, and when you come to a forum like this to listen, question, discuss, engage, agree, maybe disagree, you add to the civic health of this community in our country, and at CVS Health, we really appreciate that. We understand the importance of civic and community health. In fact, our company's purpose is helping people on their path to better health. That purpose serves as an important guidepost for making business decisions, but it's also why our more than 240,000 colleagues come to work every day. It inspires the way we approach our work and everything that we work hard to do on behalf of our patients, customers, clients, and the communities in which we live and serve. Here in Los Angeles and across California, for example, we are proud to collaborate with many local community partners who share our commitment of improving public health. And I'm pleased that representatives from several of those organizations could be here with us today. And let me take a minute to thank you for the important work that you do. Over the past decade, CVS Health has delivered purpose-driven innovations that have enhanced the health of patients and the work of physicians, hospitals, and other health providers. If you look across the healthcare landscape, there are many ways in which care delivery is changing right before our eyes, and CVS Health is excited to be in the vanguard of that change. We deliver quality healthcare to patients in more ways and in more settings than anyone else. For example, you look at online or mail order pharmacy, that's existed for many years, and CVS Health dispenses millions of prescriptions this way for patients every week. But our delivery model goes well beyond that foundation. And whether it's providing in-person infusion services in a patient's home, placing a prescription refill through our mobile app to be picked up at any of our nearly 10,000 locations, or having your physician send a script electronically to be delivered directly to your doorstep, we offer the diversity of delivery options that patients, they need and they certainly value. But delivery is just one example of meeting customer needs. There are also our patient care services and clinical programs that are helping people on their path to better health. And now we're setting out on an even more ambitious journey to lead the change that is needed more broadly in American healthcare through the combination of CVS Health and Aetna. And that's where I'd like to focus my remarks on today. What we propose is bold, it's disruptive, and it's truly unique. But it's also achievable with the right engagement at the community level. In bringing together the capabilities of two leading healthcare organizations, we can establish an innovative healthcare model that is easier to use, less expensive, and puts people at the center of their care. And as I'll explain, our new company will drive three of what we believe are necessary changes in healthcare. First, we will be local. You think about the presence that we have in communities all across the country, we will be able to engage people with the care they need when they need it. Second, we will make it simple. Through our combination of data, information, and expertise, we will make an often complicated and confusing system easier for all. And third, we will improve health. This will remain our North Star. And with the added capabilities of one of the nation's leading health benefits companies, we'll be uniquely positioned to personalize healthcare, help people achieve better health at a lower cost, and access care when they need it. And what I'll describe today is a vision for how to make healthcare work better for millions more Americans, and I hope you'll come to share that vision through the discussion that we'll have here. I think all of us know that change isn't easy, and in healthcare, I think it's even more true. A couple of months ago, I actually participated in a Q&A session with Bernard Tyson. I know many of you know Bernard, who's the chairman and CEO of Kaiser Permanente here in California. The first question that we were asked as part of this Q&A, what are you ornery about? This was a healthcare conference. We thought it was a little strange. And, Bernard and I laughed because we were probably two of the least ornery CEOs on the planet, but we actually understood where the question was coming from. There are a lot of changes facing healthcare in this country, and many have existed far too long, and they create frustration for far too many. And at CVS Health, we see the same problems you do, but we see it from a unique vantage point, through the millions of interactions that we have every day, with patients, with caregivers, with physicians, with businesses. And because we're an organization where innovation is in our DNA, we see the opportunities for improvement. Now, I want to be clear, that does not mean that America's healthcare system doesn't have its strengths. We continue to have, the best doctors and healthcare facilities in the world. People from all corners of the globe come to U.S. research hospitals for treatment, and yet, healthcare in this country, can and must work better. Every one of us here has many reasons to believe that. So let me spend a few minutes telling you what we at CVS want to do about it. We see the biggest barrier to fulfilling America's true healthcare potential is the system itself. We don't believe it's a system that was built for the present nor the future. Instead, it's a system that was designed around how healthcare was delivered for much of the last century, which is not around the patient. We would describe it as an episodic, fee-for-service, fragmented model. It's confusing, it's hard to navigate, and it's playing a significant, growing, and unsustainable cost burden on consumers. It doesn't focus enough on preventing disease or helping people manage chronic illness. It doesn't track, incentivize, or reward good performance or healthy outcomes. And it doesn't meet people where they are, give them the information they need, or help them connect the dots of care. In the end, it doesn't put consumers, notice I'm not using the word patients, I'm using the word consumers of healthcare. It doesn't put them at the center of their own care, which is where they really need to be. And that's why we're bringing CVS Health and Aetna together as one company. In this new healthcare model, we'll provide people access to more affordable care when, where, and how they need it. Care will be coordinated among the healthcare providers, caregivers, and healthcare teams, leveraging the connectivity that CVS Health can provide. So here's how we'll bring this, to life. First, we'll improve access to healthcare by, again, making it local. Would it surprise you to know that today nearly 70% of Americans across the country live within 3 miles of a CVS pharmacy? You can walk right in, you can see a pharmacist to get information about your prescription. You can see a nurse practitioner at one of our more than 1,100-minute clinics for chronic condition monitoring or a lab test, with the results sent directly to your primary care doctor. You might need to have your eyes examined or your glasses updated with a new prescription. Our optical centers inside select CVS pharmacy locations can do that for you. We can help fill care gaps between visits to your doctor, serving as serving as a complement to traditional primary care. We recognize the integral role that physicians play in people's lives, as well as the importance, of patients having a physician-led medical home. Interesting to note, about half of the people today who walk into a MinuteClinic do not have a primary care physician. And as a normal standard of practice, we make every effort to help them find one. It's one of the reasons that we've now formed alliances with more than 75 major health systems across the country, including here at Cedars-Sinai and UCLA Health, as well as the Providence St. Joseph Medical Center in Burbank, and the Veterans Affairs Healthcare System up in Palo Alto. And research shows that when people have regular access to primary care, it makes a big long-term difference in their health. In our combined company, we'll be able to offer many options to access care, whether in the community, at our retail pharmacies or clinics, or in the home, or through digital tools, through that smartphone that, I said this to someone earlier, I think I'd rather lose my wallet than lose my phone. The second thing, we will simplify the consumer healthcare experience. I mentioned earlier that care delivery today, we describe it as being fragmented. You think about patients carrying medical records with them to different doctors who treat them, and it's frustrating for both the patient and the caregiver, and it makes it difficult to get the full range of coordinated care that they need. So think about a senior citizen coming out of the hospital, feeling good enough to be discharged, but with a care plan in hand and not sure where to start. The current system is failing these patients every day, especially the most vulnerable among us who may live alone, can't prepare a meal, or may not be able to drive. In fact, about 20% of people on Medicare who leave the hospital are readmitted within 30 days. Half of those readmissions, and importantly, all the costs and the pain that come with them, can be avoidable. Preventable readmissions is costing our healthcare system an estimated $25 billion every year. Money that could be reinvested in other important priorities, whether it's infrastructure, education, the list goes on. And by extending our new healthcare model more broadly into the marketplace, patients can and will benefit from earlier interventions and better connected care that will lead to improved health outcomes. So think again about that senior leaving the hospital, but in this case, knowing that their care plan prescribed by their physician is being seamlessly coordinated by CVS and their caregiver. By fully integrating Aetna's medical information and analytics with CVS Health's pharmacy data and our 10,000 community locations, we can enable more effective treatment of the whole patient. It's better informed, better connected, and better coordinated healthcare. And our teams can help all along the way with the doctor, with the home care provider, as well as the caregiver. Third, we will help people achieve better health at a lower cost. And as I mentioned earlier, this is our North Star. When you look at how America's healthcare system stacks up with the rest of the world, I'm sure you've all seen the literature. We spend far more on healthcare than any other nation. In 2017, the U.S. is estimated to have spent 17% of GDP on healthcare. That's equal to more than $3 trillion, or about $10,000 per person. The next closest countries are between 11 and 12%. And that delta represents an additional $2,000 per person that's being spent on healthcare in our country compared to our nearest competitors. And yet the performance of our healthcare system compared to other high-income countries is one of the worst. The Commonwealth Fund, in its annual Mirror report, recently ranked the U.S. last in healthcare system performance. And that was among the 11 countries that it studied. And as part of that report, it included last in access, last in equity of care regardless of income, last in healthcare outcomes, and next to last in administrative efficiency. The U.S. healthcare system doesn't deliver the value that it should. Now, the combination of CVS and Aetna will make a difference, and the better management of chronic disease is one big and important way we can do that. These are the diseases that people live with every day. We know their names: hypertension, high cholesterol, high blood sugar. And today, about 60% of Americans have at least one. And they're very expensive. Today, chronic disease is accounting for 86% of healthcare spending. Now, at CVS Health, we have already begun work to transform care for one of the most challenging chronic diseases, and that's diabetes. Right now, and you may have seen the CDC actually published this report yesterday, more than 30 million Americans now have diabetes, 1 in 7. Scary, another 84 million people are at risk of developing the disease. I'm sure we all know someone. At the onset, it is a complex condition to monitor and manage, and as the person lives with the disease for 10, 15, 20 years, it starts to be associated with other comorbidities: obesity, cardiovascular disease, kidney disease, even blindness. So think about this. If only half of those 84 million Americans who are pre-diabetic go on to develop the disease, medical spending in our country will increase by another $400 billion. Now, we have a program that we refer to it as Transform Diabetes Care. The goal here is to improve the health of patients with diabetes, lower their costs, and right now we're doing that through better management of anti-diabetic drugs. For participants who have uncontrolled diabetes, we actually were able to help lower what's called their A1C levels by 1 point, and we were actually able to maintain that over a 6-month period. So what does all that mean? What's it add up to? Well, a 1-point drop in A1C levels can mean up to $2,800 in savings per year. And think about this, if we were able to do that for just 1/10 of the diabetes population in our country, it could mean nearly $10 billion in savings for our healthcare system. Again, this is how we're helping to manage diabetes care with the tools we have right now. Imagine what we'll be able to do, with these two companies coming together. We'll have a community presence with stores, pharmacists, retail clinic nurses, and a much more complete picture of a patient's whole health. We'll know better who is at risk of developing diabetes and provide them with preventative actions and counseling. For those who are already suffering from the disease, we'll be there more frequently when they pick up their medications to talk with them face to face, not just about managing their medications, but how to lose weight and eat better. We'll also be able to expand the use of digital tools. We will help patients monitor key indicators such as blood glucose levels and send them texts when the results look concerning. And we'll be able to do all of this not in an ad hoc or fragmented way, but seamlessly with patients, their physicians, and the many other players that it takes to coordinate care. So I've given you a couple examples of why we're so excited about these two companies coming together and the difference that we know we'll be able to make. So how will CVS Health and Aetna deliver on this vision of a better healthcare model that helps people achieve their best health? Well, one of the most important ingredient that that needs to happen, one of the success factors in bringing two entities together is company culture. And that's where, CVS Health and Aetna, do have a strong start because, we're both driven by purpose. It's why at CVS Health we decided to stop selling tobacco products back in 2014. It was a decision that cost our company $2 billion in annual sales revenue, but as we look 4 years later, it was worth every penny. Following our actions, cigarette sales fell in retailers across the country in markets where we had a significant presence. And CVS customers were 38% more likely to stop buying tobacco products. And at the same time, becoming tobacco-free began to open up new doors for business growth. Our commitment to helping people lead tobacco-free lives isn't done. It continues with our Be the First initiative, which aims to deliver the nation's first tobacco-free generation. And as part of that nationwide effort here in Los Angeles, we're partnering with the LA Trust, the LA Unified School District, and the Motion Picture Television Fund, among others, on tobacco prevention and cessation programs. Purpose is also why both Aetna and CVS Health have stepped up to tackle this opioid crisis that we hear and read about every day. Aetna was the first national insurer to waive copays for the drug that reverses opioid overdoses, and today in 48 states, CVS Health has started dispensing the same drug with no individual prescription needed. Our companies also took the important step to strengthen the management of opioid prescriptions for temporary pain or after a dental procedure. And as a result of these efforts, we have seen a 72% drop in covered opioid prescriptions that go beyond a 7-day supply. I'm sure we all have the story of whether it's the dentist or some acute injury of walking away with a prescription for 60 or 90 pain pills. And taking 1 or 2, and the rest are sitting in the medicine cabinet. And to address that, just here in California, as well as across the country, but specifically to California, we've donated 21 safe medication disposal units to local police departments. And we've installed an additional 62 units in our stores. And would it surprise you to know that just that small number has been responsible for collecting 15,000 pounds of unused prescription medications, out of people's homes, out of the medicine cabinets. And in doing that, we're ensuring safe disposal, of those unused products. Also united in our purpose, we'll be able to do more to tackle the social determinants of health. There are a lot of studies out there that say 60% of life expectancy is driven, not by your genetics, but by behavioral, social, and economic factors, including things like family, education, housing, and access to fresh food. You think about it when you're constantly worried about putting food on the table or where you're going to live. I don't know how you can possibly be thinking about, living healthy. And Aetna Strategy is to invest in communities and help people in their homes. CVS Health, through our community presence, is proud of our work in this area too, and we plan to build on it with our successful Project Health events. The goal of this nationwide program is to help people live healthier lives through free preventive health screenings, as well as support in the diagnosis, treatment, and management of chronic diseases. Now, CVS Health has been holding Project Health events in Los Angeles actually for more than 10 years now. We've provided more than $26 million worth of free medical services during that time, and this year's campaign launched here in LA just last week, and it runs through mid-December. So there is a genuine excitement among the employees of both companies in fulfilling the vision that we share in our commitment to better health. So in closing, we all feel the problems with our country's healthcare system. We feel it in our pocketbooks. We feel it in the pain that comes with disease that's unnecessary or poorly managed. We feel the frustration of a system that wasn't built for the consumer. But we have to believe that healthcare can work better, that millions more of us can get a better chance at achieving our best health. And to make that vision a reality, change is necessary. By bringing together CVS Health and Aetna, we will lead that change. We will challenge and we'll disrupt the status quo, but we'll also help to create a better, more effective, and more affordable healthcare system. We will be local, we will make it simple, and we will work hard to improve the health of those we serve. And by the way, we can't wait to roll up our sleeves and get started.